So it's Dr. Minda again. Let's finalize the series on the foot. So we go to the applied anatomy. So we have what we call plantar fasciitis. As you can see, itis means inflammation. So plantar fasciitis is inflammation of the plantar fascia, the plantar aponeurosis, and it's usually characterized by pain. So this inflammation of the plantar fascia um, and the plantar aponeurosis is what is being referred to as plantar fasciitis. Then we also have what we call the heel spurs. Heel spurs are bony spurs within the calcaneum. Okay, bony projections within the calcaneum. That's what they're being referred to as heel spurs. And these also cause a lot of pain. Okay. Then we have congenital talipes equinovarus, which is clubfoot, mainly caused by low amniotic fluid before birth. So the limb is not able to, develop properly because of low amniotic fluid. So that's what we call congenital talipes equinovarus. It's characterized by inversion and adduction of the forefoot with some aspect of plantar flexion at the ankle joint. Then we have pes planus, which is flat foot. Okay, so when the arcs of the foot are not well developed, so you get flat foot. That's pes planus, and pes cavus is when it is high arched foot. So you need to understand all these conditions of the foot because this is the applied anatomy aspect. So as we said, plantar fasciitis usually causes pain at the heel. It's just inflammation of plantar aponeurosis. So inflammation of that thick band, you remember it runs from the heel bone towards the toe. So you basically just have stabbing pain, and this usually occurs within the first steps that you take, a patient takes in the morning. And then with time, the pain normally decreases, but it may return after long periods of standing up. So that's what you call plantar fasciitis, stabbing pain basically at the bottom of the foot near the heel. Worst with the first few steps as you wake. Okay, so mainly when you get tense or stress on the fascia, probably because of repeated stretching and tearing of the fascia, that will cause irritation. And the risk factors could be some types of exercise like long distance running or aerobics, age also, and foot mechanics. For example, people with flat feet, obesity. So all this predisposed to this plantar fasciitis. So I hope that gives you some clue on what this condition is all about. Then the heel spurs. What exactly are heel spurs? Yeah. So when you have bony protrusion on the lower aspect, bony protrusion on the lower aspect of the leg, of the foot, sorry, so the calcaneum, that gives you a heel spur, and it's usually associated with plantar fasciitis, which is inflammation of the plantar fascia. So what usually causes this heel spur? When calcium deposits under surface of the heel bone, okay, and it occurs over a period of time. So when there's strain of the foot muscles and ligaments and stretching of the plantar fascia with repeated tearing of the membrane that covers the heel bone. So this can lead to heel spurs, commonly in athletes that are running and jumping. So running, jogging, excess weight, obesity, poorly fitted shoes, all these are risk factors. Others include frequent short bursts of physical activity, increase in age. Okay, so all those are heel spurs. Yeah. Then we go to congenital talipes equinovarus. As we have said, it's just clubfoot. It's a defective congenital anomaly. Okay, so it's basically it's just we call it clubfoot. Yeah, and what causes this clubfoot basically, and how does it look like? So the foot usually faces inwards, as we have explained. Inverted foot, adducted forefoot, and plantar flexed at the ankle joint. So basically, that's just it. So it can be associated with other conditions such as spina bifida, or it could just occur by itself. And also in children with trisomy 18, like Edwards syndrome, or in spina bifida, you can see it. And mothers who had suffered oligohydramnios, very less amniotic fluid, have also this clubfoot can develop. So those are the risk factors. And of course, it will affect the baby because the foot is not in a usual position. And if so basically that's it at your level. That's all you need to understand about congenital talipes equinovirus. Then pes planus. Pes planus is basically just flat foot. Yeah, it's flat foot. And what really causes pes planus? Because when you have a flat foot deformity, it's going to cause sort of stress and tension over the neurovascular structures, okay, the neurovascular structures within the foot. Because remember, the arcs are supposed to be there to protect these soft tissues that are within the foot. So there will be that strain in patients who have pes planus. So usually infants have this flat foot, but between 2 years and 3 years of age, the arcs of the foot start to form. The flat foot disappears because the tendons and ligaments now start to tighten. So but if that does not happen, then the flat foot persists up to adulthood. Flat foot can also be caused by injuries or illnesses, and dysfunction of the ligaments that are supposed to maintain the arcs of the foot. So basically, that's just it. You need to know the factors that maintain the arc of the foot for you to understand what causes flat foot. And then the last one is pes cavus. So what is pes cavus deformity? It's typically an elevated longitudinal plantar arc of the foot. So instead of a normal arc, you now have a high arc of the foot. And what causes this pes cavus? So if the tendons and the ligaments are tight, you get exaggerated longitudinal arc, and that can lead to a plantar flexed forefoot with the toes retracted. Therefore, there will be stress on the metatarsal heads and the heels during weight bearing. So in pes cavus, someone will have to be given shoes that are going to help distribute this weight, and the shoe should have a firm heel to maintain the rear foot stability. So basically, it's a postural disorder with a high longitudinal arc, and usually this arc does not flatten with weight bearing. So what really causes it is when you have shortening of the soft tissues that support the longitudinal arc. So when the plantar fascia is shortened, tibialis posterior muscles are shortened, all these will lead to pes cavus, which is a high arced foot. So it can be caused by different things, neuromuscular disorders such as muscular dystrophies, and so on and so forth. It could be congenital, yeah, and it may contribute to stress fractures and plantar fasciitis. So basically, that's just an overview of this high arced foot. So thank you very much.